Welcome to World Knowledge Channel. People are the center of all development. For that reason, anywhere, in any country in the world, healthcare is also a factor that is focused on investment. It is no coincidence that developed countries are often on the list of countries with the best health systems and vice versa. And in this article, let's learn about some countries with the best health systems in the world. 1. That is the Dharma. France is world famous for the quality of its medical services. The French healthcare system is universal, largely funded by the government's national health insurance. In its 2000 assessment of world health systems, the World Health Organization observed that France provided the closest thing to universal health in the world. The World Health Organization ranked France's health system as the best in the world in 1997. In 2011, France spent 11.6% of GDP on healthcare, or an average of $4,086 per individual, a high figure. Much higher than the average spending of European countries but lower than that of the United States. About 77% of medical costs are paid by government-funded agencies. Medical care is usually free for people with chronic diseases such as cancer, AIDS or cystic fibrosis. Average life expectancy at birth is 78 years for men and 85 years for women, among the highest in the European Union. France has 3.22 doctors per 1,000 inhabitants and per capita health spending was $4,719 United States dollars in 2008. 2. Next is Belgium. When mentioning Belgium, many people will think of the country with the world's leading football team. Not only that, Belgium is also known as the heart of Europe because of its strong economy and especially its modern healthcare system. Best of the world. According to statistics, Belgians have an average life expectancy of 81.1 years, with people in this country having a life expectancy outside the top 20 in the world. Because Belgium has a universal healthcare system, all citizens in the country must participate in compulsory insurance. People's health issues are of top concern and focus. Healthcare in Belgium is funded through social security contributions and taxes. Health insurance is mandatory. Health services are provided by a mixed public and private system of independent physicians, public, university and semi-private hospitals. Patients must pay for medical services, which are then reimbursed by health insurance institutions, but for non-qualified items, of patients and services, there exists a so-called system. Third-party payment system. 3. It's Germany. Despite being fans of beer and sausages, foods that if consumed in excess are not good for your health, people in Germany are still some of the healthiest in the world. Residents are covered through a regulated, standardized health insurance plan that allows certain groups to choose a private health insurance policy. According to the World Health Organization, Germany's health care system was 77% government-funded and 23% privately paid as of 2013. In 2014, Germany spent 11.3% of its GDP on healthcare. Healthcare. In 2013, Germany ranked 20th in the world for life expectancy at 77 years for men and 82 years for women, and had a very low infant mortality rate, 4 per 1,000 births. 4. Australia. With the advantage of mild, pleasant weather and fresh air with little pollution, it is not surprising that Australia is the country in the Southern Hemisphere ranked highest in the Prosperity Report. Here, the average life expectancy of people in this country is 82.8 years, the fourth highest in the world. Life expectancy in Australia in 2010 was 79.5 for men and 84.0 for women. Total health expenditure, including private sector expenditure, is about 9.8% of GDP. Australia began implementing universal health care in 1975. This program is called Medicare, currently nominally funded by an income tax surcharge called Medicare expropriation, currently at 1.5%. The states manage hospitals and affiliated outpatient services, and the Commonwealth funds the Pharmaceutical Benefits Scheme, pharmaceutical price subsidies, and general practice. 5. Sweden. Not only does beautiful scenery attract tourists, but Sweden as well as other countries in Northern Europe is one of the countries with the highest quality of life and health in the rankings. The Swedish healthcare system is primarily government-funded, although private healthcare also exists. Funding for the healthcare system in Sweden is mainly through taxes. Sweden is in the top 5 countries with the lowest infant mortality rate in the world. The average life expectancy of people is also among the top in the world. According to statistics, Swedish men have the fourth highest life expectancy in the world, with an average age of 80.7 years. Drinking water in Sweden is also considered to be the safest in the world. According to EHCI's ranking of countries with the best health services in Europe in 2016, Sweden ranked 12th. 6. Netherlands. The beautiful country of the Netherlands is not only famous for its beautiful landscapes with peaceful scenery, brilliant tulip fields and giant windmills. The Netherlands is always one of the top countries in the annual European Consumer Health Index in the ranking of European countries' healthcare systems, with an incredible score of 916 1,000 points. Deserves to be one of the countries with the best and most livable health systems in the world. Most hospitals in the Netherlands are privately run, non-profit organizations, but most health insurance providers are for-profit companies. The Netherlands has a network of 160 acute primary care centers that are always open, so they are easily accessible to everyone. Analysis by the Dutch National Institute for Public Health and the Environment found that 99.8% of residents could be transported to an emergency unit or hospital providing emergency obstetrics within 45 minutes on year 2015. 7. Japan. The quality of Japan's medical services is excellent. The average life expectancy of this country's people is 83.7 years. Japanese people work very hard and eat well, so the average life expectancy is the highest in the world. This has made this country a country with an aging population. Healthcare services in Japan are mainly provided by central and local governments. The costs of these personal services, which are approved by a specialized government panel, are provided by a health insurance system that is widespread and equitable across the country. Citizens who do not want to use the insurance services of the companies where they work can participate in national health insurance that is monitored and operated by local governments. Since 1973, all elderly people have been provided with free government-funded health insurance, with patients being able to choose the facility where they want to receive the most appropriate form of healthcare. 8. Switzerland. In addition to majestic natural beauty and a developed economy, people in Switzerland are extremely healthy. They have almost everything that people of any country in the world want. Switzerland provides universal healthcare. Each canton in Switzerland is responsible for licensing providers, coordinating services at hospitals and subsidizing individual insurance premiums. The special thing is that all citizens must fully participate in compulsory health insurance, aiming to provide comprehensive healthcare for people here. The Swiss healthcare system's costs are among the highest, but its results compare favorably with other European countries. Citizen patients in this country reported overall high satisfaction with the system. In 2012, life expectancy at birth was 80.4 for men and 84.7 for women, the highest in the world. Spending on health is especially high at 11.4% of GDP, 2010, but on par with Germany and France, 11.6%, and other European countries. 9. Singapore. Singapore has an overall efficient healthcare system, although healthcare costs are relatively low compared to developed countries. The World Health Organization ranked Singapore's health system 6th overall in the World Health Report 2000. The infant mortality rate was the lowest in the world in the past 2 decades. Average life expectancy, 2012, in Singapore is 83, while the global figure is 70. Almost the entire population has access to water and improved sanitation. Women in this country can live an average of 87.6 years with 75.8 years in good health. The average is lower for men. Singapore is ranked first on the Global Food Security Index. The Lion Island government healthcare system is based on the 3M framework. This has 3 components. Medifund, which provides a safety net for those who cannot afford healthcare, Medisave, a mandatory national health savings account system covering about 85% of the population, and Medishield, a government-sponsored health insurance program. Public hospitals in Singapore have considerable autonomy in their management decisions and compete for patients. However, they are still owned by the government, and the government appoints boards of directors, and the CEO and management report to and are accountable to these boards. A subsidy scheme exists for people on low incomes. In 2008, 32% of healthcare services were funded by the government. It accounts for about 3.5% of Singapore's GDP. 10. Luxembourg. Luxembourg is located between three countries, Belgium, France and Germany. Thanks to its favorable geographical location for economic and cultural development, this powerhouse, despite its small area, always tops the rankings of health indicators. Health of the Legatum Institute. In Luxembourg, patients pay initial medical fees, but are reimbursed annually between 80% and 100%. According to statistics from the World Health Organization, the average life expectancy of Luxembourg residents is 82 years because the system is extremely developed and modern, and the quality of life of the people is always of concern to the government with its endless policies. Same incentives. Luxembourg's funding ensures free, high-quality healthcare for all residents and long-term migrants. A country's health system is not only measured by how many hospitals or pharmaceuticals there are, but also by considering access, service quality and health insurance coverage. The world's best health system is not just about technology and facilities, but also about caring for and ensuring the health of all citizens, while ensuring sustainability and equity. System. If you find the video useful, please share it with more people and subscribe to the channel. Like and have any questions, please leave a comment below. Thank you for your interest in following. Hello and see you in the next video.